I think I will begin. I would like to begin with some reflections. First of all, thank you very, very much for inviting us on to join your celebration, not only of the many years that the program in bioethics has grown these 2.5 decades, to celebrate that, but also to celebrate the UNESCO and professorship. That is just a stunning accomplishment and an evidence of the kind of experience that we have had in collaborating over these many years. We have to credit both the Fulbright organization and Aminef for allowing us, both Byron and I, to come to Gajah Mada and to the Faculty of Medicine and the Faculty of Psychology, and in particular, Buyati and Paknarto, for welcoming us as Fulbright Scholars in 1996. We began with questions, in particular, about the culture of medicine. And this led to an engagement with faculty physicians, in particular, Dr. Yati and Siwi, Dr. Siwi, who is a Ph.D. professor of medical anthropology in the School of Public Health. But she wasn't at that time. She was a young scholar. It began as an interaction and emotional engagement, as well as an intellectual one, that was involved in conceptualizing the bioethical issues that grew out of clinical realities and moral dilemmas. What was happening in everyday clinical work that and actually that was challenging both the moral interactions and stances, choices for physicians and other health professionals during this time. And when we think about studying medicine, studying the culture of medicine, we're engaging with a field that is rapidly changing, whether it's in the United States or in Indonesia, and that was true at this time. Rapidly changing field where the clinical realities were quickly changing. The global and local cultural connections were, yes, there was Javanese style, perhaps treatment or interactions, but the global power of medicine was really being manifested. We were meeting minds, a meeting of minds and a meeting of hearts. And I think that was a way that we could actually begin to do research together. Just reflecting on some of the things that happened. The collaborations began in somewhat small ways. First, we had a group called Ladies Club, and various clinicians who were working on childhood cancer and doing interviews with childhood cancer, who were involved in pediatrics and caring for children with diarrheal disease, and questioning whether the use of vitamin A would be worthwhile, raising all these kinds of questions about kids really took us into a domain of looking very closely at the struggles that clinicians were having in trying to provide the best quality of care. And out of that came a number of thoughts, some papers, and challenges about how to think about shaping medicine in the future. And having the leadership that Dr. Yati and Paknerta brought, and all of the colleagues, Dr. Sutario, many physicians who participated in thinking about what the future was going to bring, and what the future challenges would be, really led people to look at the relationship of bioscience and biotech, translational research that looked at how one might be able to address what one of the doctors called in Dr. Rika's Bioscience Biotech Center, the economic gene. Whether or not one could be able to identify ways of treating, say, childhood cancer, pediatric cancer, treating those who would be most successfully treated, and not drain a family's wealth when they could not be treated well. Communications and challenges and errors in medicine were part of the global discourse at that time in the 1990s and in the early 2000s. And when we had the opportunity to host Dr. Yati as the first Freeman Fellow, along with Pak Tony Sajament, who is no longer with us, and another 11 people who came as Freeman Fellows and then Fogarty Fellows to Harvard. We were able to conceptualize various projects that would inform an international exchange. So in the year 2000, we held the Bioethics 2000 International Exchange at Gajah-Mada. Gajah-Mada ran it in the most beautiful and very, very special way, opening the entire event with Javanese gongs and singing by Dr. Sutario, and an exquisite set of lunches and dinners and conversations that address the latest issues in medicine at that time. And people from other parts of Asia came: Thailand, Taiwan, Hong Kong, China, Japan, as well as people from East Africa, who were our fellows, who had crossed each other, met each other. The Fogarty Fellows from Indonesia meeting and Freeman Fellows meeting the Freeman Fellows from other parts of Asia, who were also in our Department of Global Health and Social Medicine. And so Bioethics 2000 International Exchange was one of the very important collaborative endeavors that really set forth another agenda. And that agenda was a project looking at challenges to medicine, which was end-of-life care. And the end-of-life care projects were launched at that time, and with some of the Harvard physicians that we brought. The current head of the Harvard Medical School Center for Bioethics attended, Bob True. Lynn Peterson, who was head of the ethics program that preceded the center, also was there. And as well as Paul Farmer, our current chair, who's quite a famous guy in global health, and our former student and now our chair. And these people addressed the issue of end-of-life care, and it turned our whole focus at that time, because I also was involved in some work with people, to look at how we could do a project together at Gajah Mada. And so that was launched with Fulbright funding to Dr. Sonardo, Prof. Sonardo, and was carried out in 2003 to 2006. And we're doing another one, again, a follow-up study led by Siwi and Dr. Yati and Dr. Chris Dante, who's a nurse professor, and to look at issues and how they've changed. And as medicine has changed, both in the financing of medicine, but also in the quality of treatment, new issues have come to the fore. And so this bubbling up of engagement is also a bubbling up of ideas, a working out of both small and larger research projects, a thinking about the ways of how clinical activity is so important as a way, and the clinical challenges to physicians, nurses, and other healthcare professionals as a way to formulate some of the questions around bioethics. And also to look at translational research. That question about the economic gene that came out in 1997 in interviews with Dr. Rika and Dr. Rini, that question is still the question on the table for whether or not to use precision medicine and how to go about deciding the equality and dealing with inequalities, dealing with limitations, etc. And so I would just like to conclude with a congratulatory note to all of you, and my delight at spending these 2 decades with such fabulous people and such good friends. Thank you very, very much. And congratulations on getting the professorship.